Hi everyone, it's Casey giving you an update on my stem cell therapy back treatment that I had done last year. For those of you who don't know me, my name's Casey Conrad, and I'm making this video because I've told so many people about the stem cell therapy treatment I had done at the Docere Clinics that I keep getting emails saying, how's your back, how's your back? And I figured the easiest way to get it out there is to share this video. So for those of you who don't know, a year ago, no, not a year ago, 6 months ago actually, in 2013, I had stem cell therapy done in Park City, Utah by Dr. Harry Adelson, and my back was really bad at that point in time. I had a 10-year progressively getting worse, L4, L5, compressed and bulging. Had the treatment done, which I'm going to show you here in a minute. Took all of 2 hours, had no downtime whatsoever, was back on a plane the next day to head back home, and it has been nothing but miraculous. My life has changed dramatically. I no longer get up out of bed in the morning and need to do 5 minutes of child pose and cat and dog in order to get out of bed. Here I am, I'm at a fitness center where I just got finished with an incredible workout, things that I would never have been able to do functionally 6 months ago. And best of all, I can go down, I can go up, I can bend over, left, right, no wincing of the back, something that I could not have done. Now people ask me, is it 100%? Hey, I'd say it's 90%. Look, I just got finished shoveling about 2 feet of snow last week. Did I have some back discomfort the next day? Yeah, but you know what? I think anybody would have had back discomfort shoveling that much snow. But I don't have pain, and that's really the important thing. And so, for those of you who have never heard of stem cell therapy, I'm going to go back to the video that I did, 6 months ago, explaining to my friends what I had done and allow you to see step by step what was done. So I'll see you in a minute. This is the room where they were performing it with this very large machine that is an X-ray type machine that allows them to see exactly where they're placing the needles. So the first thing that they did was they cut a small incision in my back where they created the spot to harvest my bone marrow. This is right over my iliac crest, and that would be the equivalent of a very large, thick needle, which then, as you can see the hammer that's sitting on my buttocks, he proceeds to pound that into my iliac crest. And people say, well, did it hurt? And the answer is no. I got some lidocaine beforehand, and I would say that the lidocaine needle was the only thing that really caused me to flinch. Do you feel it? Yeah, of course you feel it, because a needle is being, pounded into your iliac crest, but there was no pain, just some pressure. This is a X-ray picture that they gave me that shows, you can see off to the left, it looks like a long rectangular dark area with dots in it, and that is the end of that needle, if you will, that is extracting the bone marrow from my iliac crest. And so you can see they then pull out the bone marrow, and they actually took 2 tubes of this because they were going to do 12 injections. It's passed off to an assistant, and I asked them to take all these pictures because I couldn't see what was going on. And as you can see, I'm giving the thumbs up down there in the bottom right hand corner. Then the blood or bone marrow is placed into test tubes that are equal to the number of injections that you're going to receive, and I was getting 12. From there, they are divided up equally. I then get sutured up, and while I'm being sutured, the test tubes are put through a centrifuge, and this is to separate these stem cells from all the other matter that is in my blood. So now I get some more lidocaine. It was probably about a 15-minute process in between the bone marrow harvest and the actual performing of the stem cell therapy. So what he's doing here, as you can see, he's got a purple marker pen, and he's using the X-ray machine. You can see the pictures up in the back to locate exactly where he wants to do the injections. There's the needle. You really can't see the whole thing. It's going up into that gauze pad, but you'll see it in a second. So there's the length of the needle. I didn't ask the length, but it's pretty long. And he inserts it using the X-ray machine to find exactly where he wants to place it, and he is putting it there between my L5 and my S1. And there you can see he's got it exactly where he wants it. And this, I think, is the coolest picture of all. You can see where the red arrow is, and you can see there is almost no space between my L5 and S1. And the needle, he has gotten it dead smack right in the middle with the tip of it in right dead center in the vertebrae. And then he injects that vertebrae with the stem cells. Now, this is probably the only time, I mean, you feel pressure, right? It's like someone's filling you up, but it wasn't painful. It was just a slight pressure. Then rinse and repeat. I was having 2 injections, one in between my L5 and S1 and one between my L4 and L5, and then he proceeded to do stem cell therapy around those 2 vertebrae in the attachment points where a lot of the pain actually is caused when you have scar tissue in your back. So you can see he just continued to place the needles. And this I thought was really cool. You can see I've circled where those 6 injections were happening at that moment. I also had my sciatica, both of those injected. And that little squiggle up at the top with the 2 balls on the end of it, yes, that is my belly button ring. I thought that was kind of fun. And there is my backside, where you can see the lower right-hand dot is the incision point for the bone marrow harvest. And then all those other spots were where I had stem cell injections done. And there I am. I think from the time I sat down on the table or lie down on the table to the time I was up, it probably was an hour, maybe an hour and 20 minutes maximum. I was in and out of the clinic in a total of 2 hours. So that's it. That's my story in a nutshell. I hope this has been interesting for you. Certainly, if you have any questions, you're more than welcome to email me. Just if you want to know my personal experience any more than what I've shared with you here. My email address is younglivingcasey@gmail.com, and good luck with your back.